Everyone would agree the reason to expand Medicaid is to provide better health outcomes to our most impoverished citizens. But just because you have a Medicaid card does not mean you have better health outcomes. Expanding our Medicaid program is not the best way to deliver care to those in need, and there is now evidence to support this. In 2008, Oregon officials wanted to expand eligibility for their Medicaid program, but only had enough funding for 10,000 of the 90,000 eligible people wanting to sign up. So they held a lottery, and the Oregon Health Insurance Experiment was born. Health economists used this unique opportunity to create the first ever randomized, controlled study of the effect of Medicaid on patients' health. The next few years, those who received Medicaid and those who did not were tracked. A new study published in the Journal of New England Medicine about this experiment showed that Medicaid coverage generated no significant improvements in measured physical health outcomes, despite the fact that the Medicaid group ended up using much more health care than the control group, including the use of emergency rooms. The Wall Street Journal reported specifically that the Medicaid group used about 35% more health services, but showed no clinical differences from the identical uninsured group across basic health measures like blood pressure, blood sugar, and cholesterol levels that can be improved with the right treatment. The same was true comparing subgroups such as those with chronic diseases like diabetes. Health spending, on top of that, was higher among the Medicaid group, despite claims that using more preventative care and less emergency room will lower costs. By the way, Oregon pays physicians about 30% more to treat Medicaid patients than Illinois does, and Illinois doctors are 1.7 times as likely as Oregon doctors to stop taking new Medicaid patients. Continuing from the Wall Street Journal, they reported that federal Medicaid rules require states to offer all-you-can-eat benefits to everyone rather than targeting public assistance to those in need. These mandates often force states to squeeze provider payments to pennies on the private dollar, further harming quality and access for the poor. Here in Illinois, we are blessed with some of the most advanced healthcare resources in the United States. We must work with our hospitals, managed care organizations, doctors, and dentists, and health economists to figure out what works best for us, especially as our budget pressures are both unique and severe. I believe we need to work closely with all involved to see if expanding programs like Access DuPage or expanding access to health savings accounts, which give individuals more accountability for their health spending while providing the insurance coverage they need, is more of a solution. We are about to make promises we cannot keep, and promising benefits that we cannot afford or that people cannot access and for which the outcomes are negligible is the wrong way to care for our most needy. If there ever was a time to proceed cautiously with the program and rethink how we provide care to the needy, that time is now. Please vote no so we can separate the good from the excessive in this bill and direct our health care dollars in the most effective way possible. Thank you.